Good evening and thank you everyone for joining us today. On behalf of NAARI division of Jagsonpal Pharmaceuticals Ltd, I, Amit Saxena, along with my teammates, Dr. Deepika Chabra from Medical Services, are delighted to welcome you all to ISOPARB updates on PCOS, organized by Madurai OG Society in association with West UP chapter of ISOPARB and YTP Committee of FOGSI. As academic partner, NAARI division of Jagsonpal Pharmaceuticals Ltd offers Cystelia-M, the right combination to restore reproductive health in both obese and lean PCOS and associated fertility. The correct ratio of 40:1, myo-inositol and D-chiro-inositol along with N-methyl folate and vitamin D. We also have Cystelia-35 OC pill contain cyproacetone and ethyl estradiol to manage acne and in PCOS. And we have ProRetro, the fully indigenized developed bioequivalent brand of dydrogesterone 10 mg tablet. A warm and hearty welcome to all the esteemed faculties and attendees. Dear attendees, if you have any questions, suggestions, clarification, please post it in the Q&A box. Please note this webinar is streaming live on Facebook and the link is already shared in the chat box. To refer this webinar recording in future, please visit our YouTube channel, Jagsonpal Medical Insights. We thank ICOG for granting 2 ICOG points to this webinar. And we thank all the office bearer for organizing this webinar. Now I request Dr. Shreya Jamal to kindly initiate the proceedings.
Thank you so much, Mr. Amit, for handing over this platform. And we welcome you all with Amit जी ने आपको बहुत warm welcome दी. मैं warm welcome नहीं देना चाहती हूँ. कुछ भीगी हुई welcome क्योंकि बारिश की फुहारें पूरी अभी हमारे North India, South India, East India, West India सब जगह है. So we are united by बरसात. तो बरसात के लिए बस इतना क्योंकि बहुत रिस्पेक्टेड डिग्निटरीज हैं, बहुत इंपॉर्टेंट लोग आज इस वेबिनार को विटनेस करेंगे. तो कुछ नशा तेरी बात का है, कुछ नशा धीमी बरसात का है, कुछ नशा तेरी बात का है, कुछ नशा धीमी बरसात का है. हमें तुम यूं ही दीवाना मत समझो, यह दिल पर असर हम सबकी मुलाकात का है. तो आज जो हम लोग दीवाने होने वाले हैं विद दिस एकेडमिक फॉर्च्यून दैट हैज बीन प्लान्ड बाय मदुराई OBGY सोसाइटी, West UP chapter of ISOPARB and Young Talent Promotion Committee of FOGSI, we welcome you all wholeheartedly to enjoy along with Barsat Ki Puhar, a cup of coffee which I just saw Naren sir was sipping और अभी फिर से शायद उठाने वाले हैं sir. So thank you so much for joining and now I request
बिन पिए नशा आज इस दोपहर का है, बिन पिए आज नशा इस बरसात का ही है.
Thank you, sir. So, Dr. Kalpana, you are most welcome and I request you to kindly take over the proceedings for our inaugural session and then scientific session. Dr. Kalpana is a gynecologist and infertility consultant at Guru Hospital. She is a secretary of Madurai OBGY Society and she has been the founder secretary of Madurai chapter of TAPISAR. She is National Coordinator of Infertility Committee of FOGSI, South Zone Coordinator of Endometriosis Committee in 2014 and 16, held many posts and has excellent academic profile and won several awards which include Best Doctor Award by Dr. MGR Medical University and Golden Excellence International Award by European University. So all over to you, Dr. Kalpana, for further proceedings.
Thank you. Thank you so much for your kind words. Good afternoon, everyone. It's my pleasure to get associated with the FOGSI YTP Committee and also West UP Chapter ISOPARB under the leadership of FOGSI President Shanta Kumari Madam and Secretary General Madhuri Patel Ma'am and our dynamic Vice President Archana Verma ma'am, who is always with us, and dynamic YTP committee chairperson, Dr. Neharika, and other respected seniors, President ISOPARB, Dr. Gangadhar Sahu sir, Secretary General, ISOPARB Dr. Mishra Chaudhary ma'am, and with our respected seniors, Narendra Malhotra sir, as our chief guest, and guest of honor being Ranjana ma'am and Bharti Maheshwari ma'am. It's our pleasure to have all our learned faculties here who are going to share their knowledge. It is going to be an academic feast for us. On behalf of Madurai Society, it's my pleasure to invite Archana Verma ma'am, who is a dynamic vice president of FOGSI now. If I want to tell about ma'am, she's such a beautiful, ever smiling, hardworking, humble person. You can reach her very easily and she will help everyone who is in need of it. And she has got so many struggles during her VP tenure. She had many health issues, had fractured leg. Even then she continued her responsibilities very actively. Even now she's having fever for the past few days. She was not, she was in the hospital yesterday. Even then she joined in various webinars and organized so many CMEs, and with dynamic hard work, she's organizing many conferences, even Vice President conference is coming soon. To introduce her formally, she is a dynamic Vice President FOGSI 2021, Founder President of West UP ISOPARB Chapter, Advisor of UPCOG, Organizing Chairperson UPCOG 2020, Past President of Ghaziabad OG Society, and Organizing Secretary of various national conferences, Chairperson of Public Awareness Committee FOGSI 16 to 18. And she has been awarded various prestigious awards like India Book of Award winner, President FOGSI Best Committee Appreciation Award when she did her Public Awareness Committee, when she was a Public Awareness Committee Chairperson. And she has received various awards from UP Governor and Abdul Kalam Excellence Award. Also, she received, and she is a dynamic and very reachable Vice President. Welcome, ma'am. Over to you for a formal welcome address.
Thank you, Dr. Kalpana. You were giving introduction as if abhi just now Dr. Malhotra said नशा आज इतना बरसात का है, तो I was just thinking कि इतना, if somebody makes you feel so happy, then that is also a sort of addiction, क्योंकि बुराई में अच्छाई में बुराई ढूंढना तो दुनिया का काम है, अच्छाई में बुराई ढूंढना तो दुनिया का काम है, कुछ ऐसे लोग लेके आओ जो बुराई में अच्छाई को ढूंढें। तो ये जो अपना है, आई थिंक आइसोपर्ब का जो बेस है वो यही है कि वी ऑल वांट ऑल टू बी टुगेदर, ऑल वर्क इन कोलैबोरेशन. दैट इज व्हाई यू सी टुडे वी हैव अ मदुराई सोसाइटी, द डायनामिक सेक्रेटरी विद अस. देयर इज नो वर्ड टू से अबाउट हर वर्किंग. So we have seen her how she's nowadays inviting each and every. She asked me minimum 20 times, what word should I say to Dr. Naren Malhotra? Will he feel like that? I mean, she was so much concerned. What should she talk about Dr. Naren Malhotra? So I said ki you cannot again say any in good introduction in such a few less time. So he's just not less than Narendra Modi. He's our favorite NM sir. So I think today's all this faculty, this Neharika Malhotra has arranged a very good program, this YTP committee as usual, and with the ISOPARB secretary, Dr. Seema Washne. All of three people are here to make all of you aware of the PCOS updates, and that is something really needed because there are so many myths. This is the only disease where there are so many myths, whether it's good for right from diagnosis, like its a name is misnomer, polycystic. The cyst may not be there when you are diagnosing the patient, and there are many myths associated. So this thing should be talked about as many times as as possible. And I think we all are waiting to listen to words of wisdom by Dr. Naren Malhotra and our guest of honors, Dr. Bharti Maheshwari and Dr. Ranjana Sharma. We are really honored to have you all here.
First of all, thanks to you for collaborating with West UP chapter in capacity of Chairperson of Young Talent Promotion Committee. Although you are also Secretary of West UP chapter of ISOPARB, you had a big role in establishing this organization along with Archana Verma ma'am and Seema ma'am. So as all of us know, she is heading the Young Talent Promotion Committee of FOGSI. She was Joint Secretary of FOGSI in 2018. She is a big infertility consultant at Rainbow IVF Agra. Too many laurels to her credit. From you, we take so much of inspiration. All the youngsters across the nation, all the young doctors across the nation, they look forward up to you to become like their Dr. Didi. So thank you, Neharika, and the platform is all yours to start.
Thank you, everyone. Thank you so much, Sheila. And first of all, I would like to extend a heartiest welcome to all of you present here from West UP ISOPARB and also from Young Talent Promotion Committee. It is such a pleasure to collaborate with Madurai Society, and I have been in touch with Dr. Kalpana and we keep chit-chatting, and we all have to go to Madurai soon, as madam was telling me today morning. And ma'am, yes, we'll all plan soon. So as you all know, that Young Talent Promotion Committee has been collaborating with other associations and societies from all over India. And we have now touched more than 94 societies throughout the past 2 years. The theme of Young Talent Promotion Committee being perseverance and transformation. And it is my aim to build a strong fraternity of empowered young doctors who are not just doctors, but also healers and mentors. And with this thought, I would now welcome everyone and would begin this program with a prayer.
ब्रह्माच्युत शंकर प्रभृतिभिः देवैः सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा। शुक्लां ब्रह्म विचारसार परमा आद्यां जगद्व्यापिनीं वीणा पुस्तकधारिणीम् अभयदां जाड्यान्धकारापहा।
Thank you, Mr. Amit, and also wishing everyone a very happy breastfeeding week. And I request all of you present here to promote and spread awareness for breastfeeding also throughout this week. Now I would like to invite Dr. Kalpana madam to invite our chief guest, Dr. Naren Malhotra, to begin this program. Dr. Kalpana.
Yeah, actually it is my pleasure and privilege to introduce Narendra Malhotra sir and invite him for his chief guest address. Actually, when I was going through his profile, his degrees and the institutions are much longer than his name. And when we think about his name, Yanam, actually India listens to, as Archana madam told, India listens to Yanam Narendra Modi, sir, Honorable Prime Minister of India. We listen to our Narendra Malhotra sir. And there are many similarities, as not only the name, we have many similarities between Narendra Malhotra sir and our Honorable Prime Minister of India, because both of them reached this position with their decades of hard work, I can tell. And they're holding prestigious posts nationally and internationally. So it is really my privilege and pleasure to introduce Narendra Malhotra sir, who is a managing director of Global Rainbow Hospitals and Healthcare, Rainbow IVF. Sir is a president in SAG and vice president FOG. Soon we would like to see you as a president of various international organizations. And sir was a past president of ISOPARB FOGSI, AOGS, and dean of ICMU. He is a professor of many international institutions in Croatia and founder editor of Suffolk Journal, member of FIGO Guidelines 2014 to 17, director Manyata CSV, and chairman of NGO organization New Level of Care. And he has received various awards, Corona Warrior Award, Nepal Saman Award, Dhanvantri Award, Achievers of India Award, recipient of, sir is a FRCOG holder, recipient of Nepal Saman 2004, DC Datta Award, Man of the Year Award, and Best Citizens of India Award, Korean Award, CS Dawn Award, AFOG Young Gynecologist Award in 1993, Indumati Javeri Award, Ethicon Fellowship Award, and SAD has edited 41 books, many chapters on editorial board of many journals, editor of series of step-by-step books, revising editor of Jeff Fort, revising editor of Donald Obstetric Manual, revising editor of FOGSI's Ultrasound in OBS-GYN. He has presented more than 38 orations, many papers and international presentation, more than 1,000 guest lectures. We would like to hear your guidance and blessings from you, sir.
So very good afternoon to all of you. Actually, I'm stuck in between emergencies, so I'll just be here for 2 minutes, and I have to be in the ICOG course also at 3 o'clock in 10 minutes. So congratulations, YTP Committee, Madurai Committee, for organizing this webinar on PCOS and to discuss nutraceuticals, to discuss lifestyle, and to discuss medical management of PCOS, which is so very important. And as Dr. Archana said, PCOS is still a dilemma. It's still a phenomena which is least understood. We need to understand definitions. We need to understand testing. We need to understand diagnosis. And of course, you don't have to leave them alone, because even from adolescent to menopause, PCOS can be there, and it can cause metabolic syndrome, which could be very severe. So my best wishes for this webinar. Have a good time. I will join back again at after an hour or so. So kindly excuse me. All the best to all of you.
Thank you so much for your blessings, sir. Your blessings is really important for us.
Thank you so much, Dr. Kalpana, and thank you, sir, for these blessings. Before we call our guest of honor, I would also like to thank FOGSI office bearers, our president, Dr. Shanta Kumari Madam, and Secretary General, Dr. Madhuri Patel, and also Vice President in charge for today's meeting, Dr. Archana Verma Madam. We also would like to thank Madurai Society President and Secretary, Dr. Jyoti and Dr. Kalpana, and also ISOPARB National President, Dr. Gangadhar, and Secretary, Dr. Pragya, for today's event. Let's go ahead with today's event, and let me take pleasure in inviting the guest of honor for today's event, the very loving and the very inspiring Dr. Ranjana Sharma. Dr. Ranjana Sharma, as we all know, is a senior consultant OBGYN, a urogynecologist, and a robotic surgeon from Indraprasth Apollo Hospital, New Delhi. She has been the chair of AICC RCOG, North Zone, also an MRCOG examiner, been an executive committee member of AOGD, Delhi Endoscopic Gynec Surgery, NARCHI, also the past chairperson of Urogyne Committee of AOGD. Welcome here, ma'am, and we would like to take some blessings for you for today's event.
So thank you very much, Neharika, for the kind words. I'm delighted to be here with all of you, and really thank Archana, Dr. Archana Verma, who's such a, who's an awesome person, and such a, down to earth, very approachable vice president of FOGSI. So we are very fortunate to have her with us, and really I'm grateful for all the organizing teams like ISOPARB and West UP branch of ISOPARB, YTP committee, and all of you to give me this honor, and I cannot thank you enough for that. So I have always seen you encourage youngsters like Neharika, and I think she's doing such a wonderful job, and I think at such a young age you've got such a brilliant CV. So I really want to see your future. I can foresee 10 years down the line where these youngsters like Neharika will be, and all the credit goes to the seniors like you all, sitting supervising these people, encouraging them to come up. So I'm very, very appreciative of that and impressed with the infrastructure of ISOPARB. So thank you very much, Madurai Society, Dr. Kalpana, and you all are doing great work, excellent webinars I can see every now and then. And what can be better than talking about PCOS, which is a lifestyle disease, and lifestyle is a problem these days. And how many youngsters we see in our clinic day in and day out with this problem. So very, very apt topic and excellent, faculty you have gathered. So I wish you all for the excellent, session today, and would love to be with you throughout the session and till the end. Thank you very much.
Thank you, ma'am. And I now invite Dr. Seema Varshne, madam, to please introduce our next guest of honor, Dr. Bharti Maheshwari.
Hello, everyone. A very good afternoon to all of you. On behalf of West UP chapter, I welcome you all. Our legendary guru, Dr. Naren Malhotra sir as chief guest, and Dr. Ranjana Sharma, Dr. Bharti Maheshwari as guest of honor today. And my heartiest congratulations to Madurai Society President, Dr. Jyoti, and Secretary, a very vibrant Secretary, Dr. Kalpana, for organizing this very wonderful webinar in association with YTP Committee and West UP Chapter ISOPARB. And my heartiest congratulations to very hardworking, very vibrant, very inspiring Dr. Neharika Malhotra. And my gratitude to all the office bearers of the FOGSI, Dr. Shanta Kumari and Dr. Madhuri Patel ma'am, and President ISOPARB, Dr. Gangadhar Sahu and Dr. Pragya Mishra, and President West UP Chapter and Vice President FOGSI, Dr. Archana Verma ma'am, and patrons, Dr. Naren Malhotra and Padam Shri, Dr. Usha Sharma ma'am, and I welcome all the dignitaries and all the eminent speakers and chairpersons who have logged in today. So now this is my proud privilege to invite guest of honor, Dr. Bharti Maheshwari. She is professor and head department of Obs Gynae and Muzaffar Nagar Medical College. She has done diploma in IVF and reproductive medical medicine, Germany. She is chairperson FOGSI MTP Committee 2018-20. She has got fellowship in medical education by MCI FIME, and she is governing council member elect ICOG, joint secretary UPCOG. She is vice president Merit Obs Gynae Society. She is author and editor of many textbooks of Obs and Gynae, and she has published paper and review articles in Index Journal. And she delivered Kamini Now oration and other talks in national and international conferences. She has organized North Zone and UPCOG conference as organizing secretary. She is national coordinator, MTP Committee 2015-18, executive member, and endocrinology committee, and public awareness committee, and medical education committee. So dice is yours, Dr. Bharti. Please come. We all welcome you.
Thank you, Dr. Seema Vashne, for nice introduction. And I understand that we are together for long years, so my CV is also long years back. So now many things are changed. But thank you very much. And first of all, I would like to congratulate whole organizing team of today's webinar and Dr. Archana Verma. As you said, that she is the ISOPARB West UP chapter president as well as the vice president FOGSI. How dynamic she is, we know, and how beautifully she organized so good academic activities. As ISOPARB West UP chapter is very close to my heart, so this is also one effort in this direction. And as well as the YTP committee chairperson, Neharika, we know her capabilities, her potential, her work, so we're really proud of her, that how she is doing. And as well as Madurai Society's president and secretaries, we have organized many MTP committee sessions. So I am so happy that I am again invited here and got opportunity to meet you all. So thank you, Dr. Archana Verma Madam and all team for making me part of this event. And regarding PCOD, we have a very interesting sessions in next 2 hours. But again, this is very important topic, and we always learn about the PCOS, especially the new things, new adjuvant supportive treatments, lifestyle management, so that we can get optimal treatment for patient. And the special thing is that Chief Guest Dr. Naren Malhotra sir, he is always very inspiring. And thank you for giving me this opportunity, honor. So thank you very much and best wishes for today's session. Thank you.
Thank you, Dr. Bharti. Thank you. I just also want to put it on record my thanks to ICOG chairperson and ICOG secretary on behalf of West UP ISOPARB
Yes.
chapter and Madurai Society and YTP committee. Thank you all.
Thank you, Dr. Bharti. And we are getting 2 ICOG points in this webinar. So thank you, ICOG committee. So Neharika.
Yes, ma'am, thank you. And I now invite Monisha to take over the further scientific program. So Monisha is an MD OBGYN, and she has recently done her training with ICOG in reproductive endocrinology and is also a very active member of the Young Talent Promotion Committee of FOGSI. Over to you, Monisha.
Good afternoon, everyone, respected faculty and respected seniors. I am so glad that we are having this particular session. PCOS is indeed a black hole when it comes to management, when it comes to etiopathogenesis and its treatment. Nutraceutical, the first topic itself, is something that most of the time we have actually read from our medical representatives. And whatever they used to tell us, ki, this is the one of the treatments, yeah, we will give and we'll see and let you know kind of situation. But it's all thanks to webinars, it's all thanks to recent researches that we have come up with the causes and its effects, especially from the micronutrient supplementations to its effect and the root cause to the PCOS. So for this, I welcome Dr. Neharika ma'am for its first session. Please, I'm requesting Deepika to please share the CVs. For the first session, we invite our chairpersons, Dr. Manisha ma'am, Dr. Nilima ma'am, and Dr. Meenakshi ma'am. Good afternoon, everyone. Dr. Manisha ma'am has done her MD from PGI Chandigarh and has been a professor and HOD of the Santosh Medical College, Ghaziabad, has more than 20 years of the teaching experience and has guided many postgraduates with many publications in the international and national journals with the area of interest in adolescent health and endocrinology. Dr. Nilima ma'am, Dr. Nilima ma'am has done the MBBS MD FICOG, is a professor in the Santosh Medical College of the Ghaziabad, has been awarded as the HOD of the year of 2021, has the teaching experience of more than 25 years as a professor of 14 years, has done several publications in the national, international, indexed and peer-reviewed journals with the speaker in various symposiums, CMEs, conferences in the national state level. Has been the scientific secretary of the UPCOG 2020 with the area of interest in the micronutrients and high-risk pregnancies. Dr. Meenakshi ma'am Ma'am is an MBBS, MD from AIMS, FIC-MCH and FICOG, has been a consultant obs and gynae from the Yashoda Super Speciality Hospital Max PPG Cloud9, is the next senior research associate of the AIMS, and has been a former specialist Dr. Hegde Arogya Sansthan of the government NCT Delhi, has been awarded with the 2003 Dr. R.D. Pandit's Research Prize, 2017 Dr. Abdul Kalam Appreciation Award, 2020 of the International Women's Day Excellence Award, 2022 recently of the Chikitsa Seva Samman by IMA East. Has been a secretary of the Delhi Gynecologist Forum of East and has publications in the international national journals with the area of interest in the gynec, endoscopy and vaginal surgeries. We welcome you, three chairpersons, ma'am. I request Dr. Manisha, ma'am, to please introduce, give a brief introduction of Dr. Neharika, ma'am, our first speaker.
Thank you, Manisha, for the kind introduction. And first, I'd like to thank ISOPARB West UP Society to invite me to chair this first session. Now, who doesn't know Neharika? So just to complete the formality, she's the chairperson YTP Committee FOGSI, and she is infertility consultant at Rainbow IVF Agra. And she has many awards to her credit, like Young Investigator Award in Malaysia, and many others. Has many books and chapters to her credit, and and has many publications in various national and international journals. So without wasting any time, I would request Dr. Neharika to deliver a talk, please.
Thank you so much, madam, and thank you to all my chairpersons here. Today, I'm going to be speaking on something which is very close to my heart, and it's something which is very different. We are going to be talking about nutraceuticals in infertility. We have seen a lot of things coming up right now, and a lot of new words which have been started using in our terminology, like nutraceuticals, like adjuvants, micronutrients. Let's understand what these are and what are the actual role of any micronutrient in infertility. And these antioxidants which are being promoted so much, do they really play an important role in improving fertility or not? So the first important thing is, or the first important definition which we would like to understand is nutraceuticals. So when we talk about nutraceuticals, nutraceuticals is a term derived from nutrition and pharmaceutics. So these are products which are herbal products or dietary supplements which are found in specific diets and can also be found in processed foods. And these are used as medicines. So that's the first thing which we should understand. And examples for nutraceuticals which we commonly use are like ginger. We use a lot of ginger even in pregnancy for combating nausea. Also, lycopene has been used frequently, and lycopene is also a nutraceutical. The second word which you should understand is micronutrient. So micronutrients are chemical elements. So they are not herbal products or products from food. They're chemical elements or substances which are required in trace amounts in our body for normal growth and development. Then the third word which we use is adjuvant. So anything which you add to your treatment is known as adjuvant. That means this will serve to aid or contribute to the success of your treatment. So these are three important things which you should understand. And when we talk about all these adjuvants, we know that there is some role of them in improving the quality of oocytes, quantity of oocytes, even improving the embryo quality, endometrial thickness, and also decreasing the incidence of medical complications in pregnancy. But when we talk about such adjuvants, this is a huge long list, and we as gynecologists have to understand what to use where. Ask yourself some questions that, does my patient really need this? Can my patient actually afford it? Can you afford to add any adjuvant in your therapy? Do you have the adequate amount of information regarding this? And will it really increase your success rates? So once we understand adjuvants, there is a term known as unexplained infertility. Unexplained infertility is infertility where no specific cause of infertility was found out during routine investigations. But it is said there are subtle changes in such patients, especially when they have mild endometriosis, which will affect their tubal function, or they have some form of tubal disease, though their tubes are patent, or they have premature ovarian failure, subclinical autoimmune diseases, altered microbiota, of course, lifestyle and psychological effects, and a mild to moderate male factor. And these are patients which have high oxidative stress in them. Whenever we talk about oxidative stress, we understand that the balance of the reactive oxygen species gets changed, and we have high reactive oxygen species in our body. And this oxidative stress is actually responsible for a lot of issues in the body, especially during reproductive age group, like PCOS, endometriosis, preeclampsia, age-related fertility and menopause, and unexplained infertility, and also can cause a fetal growth restriction. So these are reactive species. They are known as toxic radicals. And as we studied in chemistry, they can be hydroxyl, hydroxyperoxide, nitric oxide, nitrogen dioxide, and many others. When we talk about our body's natural defense mechanism, we have enzymatic antioxidants and non-enzymatic antioxidants. And these are the antioxidants which are naturally present in our body. But when oxidative stress or ROS increases, these enzymatic antioxidants decrease. And that's how the ROS starts causing problems, especially in infertility. And there are a lot of chemical reactions which happen in the body when the ROS increases. So to understand these, now you understood that what is oxidative stress, how will an adjuvant or a nutraceutical benefit us during this oxidative stresses? It will improve the health, it will delay the aging process, it will prevent any chronic diseases and increase the life expectancy, and also support the structure and function of the body. These nutraceuticals are now divided into potential and established nutraceuticals. So potential nutraceuticals are one which have a promising approach, but they do not have any established data to back up. Established nutraceutical is the one which has sufficient data to demonstrate that it is actually beneficial. So we understood now what are nutraceuticals. They are different from micronutrients, and they are based on different classifications, like they're based on chemical groups, which can be prebiotic, probiotic, dietary fibers, fatty acids, lipids, proteins, etc. Then they're based on source, which can be plant, animal, mineral, or microorganism. Common antioxidants which actually benefit in infertility or reproductive health are vitamin E. Vitamin E is now an established nutraceutical. So I'm going to be talking about established and potential nutraceuticals throughout my talk. Established means they have sufficient data to back up. Potential means that they are showing effect, but they don't have data. So vitamin E and D have established nutraceuticals. Vitamin E improves the blood vessels in the endometrium. Vitamin D is one of my favorite antioxidants to be used, and it has benefits from head to toe, and we'll be discussing that ahead. Myoinositol is a potential nutraceutical, so it still has to get to that level, but it is coming, and it has shown to improve ovarian function and improve insulin resistance. L-arginine also is a potential nutraceutical improving endometrial blood flow. Then we have N-acetylcysteine and polyunsaturated fatty acids, and both are actually needed for proper steroidogenesis in the body. We also need small amount of selenium, zinc, and pentoxyphylline, and all these three are strong antioxidants, but they're potential nutraceuticals. So how effective are these? Cochrane meta-analysis was done, and they did around 6,510 women were studied, where they were given oral antioxidants versus a placebo. And then they published this trial, which was a huge 50 trial compiled, and which did say that adding a good antioxidant improved live birth rate, clinical pregnancy rate, and even decreased the miscarriage rate. And that's where the roles of nutraceuticals and micronutrients started coming up in a big way. So just from these past 5 years, we have heard a lot about antioxidants, and they have now proven antioxidants or nutraceuticals in many conditions, especially commonly used for allergies. Allergy, we know, is a disorder for immune system, and adding a good antioxidant here will be beneficial. And it's been proven that antioxidants work for cardiovascular diseases, especially a diet rich in vegetables and fruits do have a protective role. Of course, citrus foods also have a good role in improving cardiovascular diseases. And how they actually work is they block the angiotensin converting enzyme and prevent platelet aggregation. We all have been talking about cancer, and we have seen how cancer is rising and is now becoming a huge public health concern. Lot of things in our nutrition are important, and it is our environment and nutrition which is responsible for high cancer risk. And now we have to break that cycle. So adding a good antioxidant, especially lycopene, has shown to decrease oxidative stress. Citrus fruits, beta carotene, and even tannins have been shown to have anti-cancer properties. So these are proven benefits of nutraceuticals. Also proven benefits in diabetes by omega-3 fatty acids and obesity. Obesity is also a very big issue, and it's going to be discussed later. But adding good antioxidants will help the patient lose healthy weight and improve the effects which are being caused by obesity. So let's discuss some few important drugs which have to be used in your reproductive health patients so that you can have a better success rate. Commonly used, and one of the most important one, is coenzyme Q10, and it is very, very beneficial and is now coming as under established nutraceutical, showing very important cellular antioxidant properties and an energy promoting agent. So we know that CoQ10 actually is involved in energy production of the cell, particularly in mitochondria. So adding a CoQ10, especially if the women are above the age of 35, will be beneficial because it will limit the age-related changes which are happening and improve the oocyte quality for that age group. Another one which we actually like to add is an omega-3 fatty acid, and it has shown that adding an omega-3 fatty acid will improve clinical pregnancy and live birth rate. So also selenium, a little amount of selenium is now being given in almost all multivitamin supplements which we have, and that's how they actually work. Selenium also improves the antioxidant properties. It also has its own antioxidant properties, but it also improves the antioxidant property of other drugs. So that's where it helps. Lycopene is a powerful antioxidant which reduces oxidative stress and will improve your oocyte quality. Vitamin D, one of my favorites. It works at all ages for healthy women from IVF, PCOS, adolescent, menopause, endometriosis, anywhere possible. And it has multiple benefits. So adding a vitamin D to any age group of women, preconception, during pregnancy, menopause, or infertility treatment will actually improve your success rate and decrease the pregnancy complications which happen. First, it is one drug which acts from head to toe. Even in children, it actually has an added benefit. So do add a vitamin D if you are having a patient of PCOS, because we are discussing PCOS. And PCOS, it has been shown that 36% of Indian women are affected with PCOS right now, and most of them will have vitamin D deficiency. So there is a lot of evidence which has been studied, and this was a huge study done by 16,000 women, where this women with infertility were tested for vitamin D, and they did say that most of these women had vitamin D deficiency, and when they were offered exposure to vitamin D, their chances of live birth increased. Another favorite of mine is probiotic, and probiotics has now come up in a big way. It has now been called as the wonder nutrient. So it is not only given for all the GIT disturbances which we used to give it for previously. It has now changed our therapy. It is now supporting the immune function, especially supporting the vaginal microbiota and maternal intestinal flora. And if you have a healthy maternal intestine flora, there is increased fetal immunity, decreased risk of preterm deliveries and bacterial vaginosis, and decreased urinary tract infection. And all this will actually reduce the pregnancy complications which happen. So adding a probiotic to infertility patients and PCOS patients will definitely improve your success rate. A big talk on myoinositol, D-chiroinositol was done, and a lot of things are now coming up saying that these are really important. They are commonly found in grapefruit and leafy vegetables if you talk about diet, and they are a form of B complex vitamin. When the balance between myoinositol and D-chiroinositol gets disturbed, it starts getting affected in the ovaries, and that's where the polycystic ovarian syndrome comes up. So to get the correct balance of myoinositol and D-chiroinositol, you have to give them, supplement them through from outside to patients who have a AMH level of higher than 6. DHA, we have all studied and known, is a superfood for brain, eyes, and nervous system. And we have multiple benefits of DHA, which I will not go about, but we know it is very important for the development of brain of the fetus and a very essential nutraceutical to be added during pregnancy. Moringa is now coming up in a big way for infertility, and patients with infertility can benefit from its enormous potential, but it is still being studied and will be coming in the next few years, will become one of the important nutraceuticals in our list. Why do we talk about the nutraceuticals? There are a lot of technologies which are happening in USA and UK, which are now talking about nutraceuticals as the first line of treatment for chronic diseases, unexplained infertility. There is this technology known as pond technology, where they're now studying algae from pond, which is available, and will use that as a protein supplement. It is shown that this algae has almost 70% of protein content and will be an eco-friendly superfood in the environment. Also, an American technology which is coming up as Z Biotics, they will now engineer probiotics according to the body need. So nutraceuticals are now, we understood, are in a big way and are defined as substances which have physiological benefits and also provide protection against chronic diseases. They can help in improve your health, delay the aging process, prevent chronic diseases, increase life expectancy, and improve the support structure function of the body. They are also having proper interest recently in unexplained infertility and improving your reproductive outcome. Therefore, it is my humble effort now to bring in nutraceuticals to all of you, and also requesting you to start studying these nutraceuticals and coming up with a good study so that we also can have adequate data on how each nutraceutical is important in and how it works for Indian population. So thank you everyone. Thank you for having me here today.
Thank you so much, Neharika ma'am. It is indeed like a Jack in the Box situation. You like literally opened so many, like a Pandora box itself, you know, so many topics that came out and so many important topics. There are so many people, you know, coming up to us like, how does this affect and how does this, you know, affect your PCOS and other health related issues. And I think you have helped a lot. I request Dr. Nilima ma'am, if she's there, and Dr. Meenakshi ma'am to please give their summarize and give their expert opinion on this.
Thank you, Dr. Neharika. It was really a wonderful talk. I missed the last few slides, I suppose. But then, just as you very correctly said, we have been using these drugs, say ginger and all, and then the lycopene, vitamin D, we have been using. But the new term has come up, the nutraceuticals, which we all didn't actually know. Most of us didn't know, and now we are into it. And then it doesn't have the effect only on infertility, but also, just as you said, in many chronic diseases like diabetes, cancer, etc. So we all are looking forward to use them more frequently in our day-to-day life, especially for the treatment of infertility. Thank you, Dr. Neharika. Okay.
Thank you so much, ma'am. Thank you so much, ma'am. Ma'am, you really helped us with all these. And Dr. Manisha, ma'am, if you have any few words to say, you're there.
Yeah, I'm logging in with Manisha's phone actually.
Yes, ma'am, no issue.
Yeah, much has been said by Neharika and Dr. Nilima. So nothing much to be said, and wishing everybody all the best. And I think we should move on to the next session.
Thank you so much, ma'am.
Thank you,
Thank you.
ISOPARB YTP chapter.
Thank you, ma'am. Thank you, Manisha, ma'am. Thank you, Nilima, ma'am. Thank you, Dr. Neharika. It was wonderful for you to be here and give us this amazing session. We move on to our second session, the PCO and infertility. The balance that has already been there with the PCO and infertility, it is something, from the correct guidance to a misinterpretation and a management. It is so much required that we are privileged to have speakers as Dr. B. Kalpana ma'am with us. Ma'am has already been introduced, but I would expect Dr. Supriya ma'am to be. Dr. Deepika, could you please share the CVs? Thank you so much. Dr. Supriya ma'am and Dr. Vidhu Mudgil ma'am for the chairperson of this particular second session. I introduce Dr. Supriya ma'am. Ma'am has been a secretary Patna of OBG Society and has been a chief consultant of the SM Hospital Patna. Has been a specialist at Government Hospital and a communicator of Central ISOPARB, East Zone Coordinator of Adolescent Health Committee FOGSI, with a member of Adolescent Health Committee FOGSI, executive members ISAR Bihar Chapter and IAG Patna Chapter, with many awards to her cap, and has held post for a very long time, has been a joint organizing secretary of the VOXCon 2014, 2016, and the ISOPARB National Conference, and many more, with a special interest in high-risk pregnancies and preventive oncology. We welcome you, ma'am. Dr. Vidhu Mudgil, ma'am, could we please have her CV? Dr. Vidhu ma'am has been of the MBBS MD of the Consultant Director of the Suman Hospital and a New Life Infertility and Research Center. Has been a lifetime member of FOGSI, ISAR, SAFOG, IFS. Has been the president of the Ludhiana Obs and Gynae Society. Has been a member of Inner Wheel Group, with a TOT trainer in HIV and AIDS, and has been a member of the Safe Motherhood Committee of the FOGSI, with many awards like Best Student Gold Medal in Surgery, Nari Shakti Award, and has presented many national and international conferences, has been giving training to the fertility of IRM Calcutta under Dr. B.N. Chakrabarti with the FOGSI ultrasound course, and has been working as a fertility expert over the last 20 years with a special interest in infertility and high-risk obstetrics. We welcome you, ma'am. I now welcome Dr. Supriya ma'am, and please requesting Dr. Supriya ma'am to please introduce Dr. B. Kalpana ma'am, our second speaker.
Thank you, Dr. Manisha, for all the wonderful words you spoke for us. Thank you, and I bring greetings to all of you from Team Patna OBGY Society, and I'm privileged, I'm thankful to the organizers, especially the West UP chapter, Dr. Niharika Malhotra from YTP Committee, and Dr. Seema Vashne, then Secretary of Madurai chapter of TAPISAR, Dr. Kalpana, Secretary and President. I really thank all the organizers for having me here as a chairperson for this session. So to briefly introduce Dr. B. Kalpana, she is infertility gynecologist and infertility specialist at Guru Hospital. Other responsibilities she is actually the secretary of MOGS, founder secretary Madurai chapter of TAPISAR, executive committee member of TNFOG, national coordinator Infertility Committee FOGSI, South Zone Coordinator, Endometriosis Committee she was, and then she has got many academic profile. She has got had been the invited guest faculty in many national and international conferences, organized many conferences on laparoscopic workshop. She had been awarded with many like Best Doctor Award in NGR Medical University Golden Excellence International Award. And I think Dr. Kalpana, you are wonderful. You have got many accolades to your credit. So with these words, I request you to present your topic. Thank you very much.
Thank you, Dr. Supriya, for your kind words. Polycystic ovarian disease is a complex metabolic syndrome which can affect pubertal girls and
थोड़ी सी अदरक ना पतली पतली काट के लच्छे में रख देना उसको और हरी मिर्च
reproductive age group women and also perimenopausal women. So, because it is a heterogeneous syndrome and it starts in utero, we have to catch the polycystic ovarian disease at the earliest in the adolescent group itself, so that the patients do not get into complications like metabolic syndrome or infertility and sometimes cancer. So the incidence of polycystic ovarian disease increasing worldwide. Almost 36% of adolescent girls have polycystic ovarian syndrome. So polycystic ovarian syndrome treatment is formed in 2018 consensus with the involvement of 71 countries and 37 societies, and it took almost 15 months to come into a final conclusion about the consensus. So the polycystic ovarian disease is now mainly diagnosed with the clinical or biochemical evidence of hyperandrogenism, which is free testosterone. It should be tested very carefully in a reliable lab with the reliable method to diagnose high level of free testosterone with mass spectrometry and ELISA. So clinical evidence of hyperandrogenism like acne, alopecia, hirsutism should also be noted, and ultrasound is not gaining so much importance in the diagnosis of polycystic ovarian disease. And when we go into the pathogenesis of polycystic ovarian disease, it is mainly the insulin resistance, which is the culprit for all the metabolic complications like infertility, metabolic syndrome, hyperandrogenism, and malignancies. So, how are we going to treat the patient with polycystic ovarian disease with infertility? So initially we need to correct her blood sugars and BP, because all these factors would increase her complications during pregnancy. Before starting ovulation induction, always exclude pregnancy, because these patients can have irregular cycles. So at the same time, the ovarian response may be very, very poor and prolonged. So prolonged use of ovulation induction agent should be avoided. So whenever you are starting some ovulation inducing drugs, we have many drugs available in the market. So always discuss about the merits and demerits of these drugs to the patient, and let her also decide about the treatment protocol. So universally, it has been accepted now that letrozole is the first line of choice, because the mechanism by which letrozole acts is an aromatase inhibitor. So estradiol level is reduced, which can cause negative feedback on the pituitary. So why are we using letrozole as the first line of treatment in infertility? Because we have enough evidence of literature evidence to support that letrozole is better than other ovulation inducing agents in terms of live birth rate, which is almost 50 to 60% higher than clomiphene citrate, which has been published in Fertility Sterility 2009. And systematic reviews also concluded that letrozole is better than other ovulation-inducing agents. And as far as the side effects are concerned, letrozole, the side effects like anti-estrogenic effects are very, very less compared to clomiphene citrate. Letrozole is quite common for monofollicular development, so multiple pregnancy risk is also reduced. The letrozole resistance is very, very rare compared to clomiphene citrate, which is quite commonly we encounter. As far as the safety of the drug is concerned, we have enough evidence published in human reproduction. There is no major congenital anomalies. So considering all these factors, the improvement in the live birth rate, minimum side effects, and reduced complications related to pregnancy, letrozole should be the first line of treatment. When we think about the pathogenesis, insulin resistance, which can cause hyperandrogenism, which could cause anovulation, hirsutism, and also metabolic syndrome. So we have various regimens of letrozole. It can be used. The standard dose is 2.5 to 7.5 milligrams for 5 days. It can be extended for 10 days also. There is a single shot dose, 20 milligram. Whatever it is, the ovulation rate is almost similar. So as we have already discussed, it is the androgen aromatase inhibitor. So estradiol conversion is inhibited. So negative feedback is blocked. So what about the other ovulation-inducing agents? Clomiphene citrate is the other one. We have the unfortunate event with clomiphene citrate is multiple pregnancy rate is increased. The mechanism, we all know that the structural similarity of clomiphene with estradiol, so it blocks the estradiol receptor. So the negative feedback of estrogen on pituitary is blocked. The unwanted side effect of clomiphene citrate is the effect on endometrium and cervical mucus. Thin endometrium is quite common in patients with clomiphene citrate. So there is a gross discrepancy between the ovulation rate and pregnancy rate as far as clomiphene citrate is considered. Metformin is also considered as ovulation-inducing agent, but whenever we are starting with metformin, we need to counsel the patient that metformin is not a better ovulation-inducing agents. We have better ovulation-inducing agents which can have a better ovulation rate and live birth rate. So as far as metformin is concerned, the Cochrane review concluded that it improves ovulation rate and pregnancy rate. There is no increase in live birth rate or change in miscarriage rate. So metformin can be used along with other oral ovulogents, especially if BMI is more than 30. Metformin can again be considered in patients with clomiphene resistance and sometimes even with gonadotropins also. The multiple pregnancies are expected complication of clomiphene citrate, and ovarian hyperstimulation syndrome is also possible. So the possibility of clomiphene failure is quite common if the patient is not pregnant for 6 cycles. It could be due to its anti-estrogenic effect on the cervical mucus and endometrium. Clomiphene resistance is the patient do not respond to clomiphene. The cycles are anovulatory. The reason could be due to hyperandrogenemia and insulin resistance and obesity. So the next line of treatment for infertile patients would be gonadotropin. It can be considered as a first line of treatment in selected group of patients. So second line of management, we have LOD and gonadotropin. But how to decide about the treatment protocol if the patient is coming from faraway place and cannot go for regular monitoring with ultrasound because multiple pregnancy and ovarian hyperstimulation is quite common with gonadotropin. In that occasion, if the patient is not affordable for gonadotropin, LOD would be a better choice. So gonadotropin can be considered in a patient who is nearby and can have regular follow-up and can afford for the cost involved in it, can go for gonadotropin because the live birth rates are better with oral ovulogents, and the patient should be counseled about the complications and cost related to it. Anti-obesity agents are still experimental. LOD can be considered as a second line of treatment. Always counsel the patient about the intro and post-operative risks involved in it, because sometimes the ovarian reserve is reduced to some extent in few patients, and risk of peri-adnexal cell adhesions are there. The advantage of LOD is there is no hyperstimulation, no multiple pregnancy. The cost is also not very high. Bariatric surgery, not in patients with infertility. The third line of management, if the patient is not responding to oral ovulation gonadotrophins, then we need to shift to IVF as the third line of management. Single embryo transfer is preferred whenever we are stimulating the patient. Always think that hyperstimulation risk is there. Whenever we think about stimulation and the choice of gonadotrophin, there are literature evidence to say that there is no great difference in the recombinant and urinary gonadotrophin as far as the live birth rate and pregnancy rates are considered. Ovarian hyperstimulation syndrome is also similar. So there is insufficient evidence to recommend a specific FSH preparation now. So should we use exogenous LH in these patients? The literature evidence concluded that there is no universal need for recombinant LH for these patients. As far as the protocol is considered, there is sufficient evidence to conclude that antagonist is preferred over a long agonist protocol, because the live birth rate is almost similar in antagonist protocol and agonist protocol, but the safety precautions are better with antagonist protocol, and hyperstimulation syndrome is really less in antagonist protocol. So metformin can be used with antagonist protocol to reduce hyperstimulation syndrome. It can be started with 1000 and gradually it can be increased. As far as the trigger is concerned, HCG can be used at the lowest dose, but if the patient is at risk of hyperstimulation, we can go for GnRH analogs as a triggering agent, but always think that GnRH analogs would cause luteal phase defect and would definitely reduce her pregnancy rate. So when you are planning for GnRH analogs, always go for freeze-all protocols so that the pregnancy rate in FET cycles are not affected by GnRH agonist. So it has been concluded by Cochrane review also GnRH analogs, if it is used, it should be the freeze-all protocol. So consider elective freeze-all embryos. So to conclude, when a patient with polycystic ovarian disease with infertility comes, we need to think about the first line of management as oral ovulation and letrozole. And if it fails, we can go for gonadotrophin or LOD depending upon the patient characters. If that fails, the third line of management would be IVF with antagonist protocol, and GnRH agonist can be considered as a trigger.
Excellent presentation, Dr. Kalpana. Yeah, very rightly said.
Thank you so much, Dr. Kalpana. It was an excellent topic and excellent presentation. You have, I think, done from the A to Z covering every topic of this essential requirement for the PCO and infertility. Thank you so much, ma'am. I request Dr. Vidhu ma'am to please give her expert opinion on this particular topic.
Good evening to one and all. I would like to thank to give me this opportunity to be chairing this session, and it's a very great initiative taken by the YTP team and the Madurai Society, and the lectures are excellent. Dr. Kalpana has actually given a very excellent talk, and it's absolutely clear that if we have once decided that we have diagnosed that she's a PCO, nutraceuticals also play an important part. Our lifestyle also plays an important part to give a good result into our whatever treatment we give. Yes, to start with, all the treatments are tailor-made according to the patient's profile and her age to get a good outcome in a PCOS patient. Thank you once again for giving me this opportunity.
Now you're.
Thank you so much, ma'am. Thank you so much, ma'am.
Yeah, even I would
Thank you, Dr.
congratulate Dr.
Archana.
Kalpana for the wonderful presentation on PCOS and infertility. Very wonderfully summed up everything. Thank you.
Thank you, Dr.
I also want to say that Kalpana, very well done, and you are a very good speaker, and what a great, topic you choose also, and very nice. I'm so proud of you, and it's a West UP ISOPARB collaboration. We are highly privileged people to collaborate from Uttar Pradesh to Tamil Nadu. So thank you very much for that opportunity.
आप सबको अपॉर्चुनिटी देते हैं और सबको मौका देते हैं कि वो आगे आए और आइसोपार्ब को एक डिफरेंट लेवल पे लेके जा रहे हैं. Thank you so much.
Thank you. It is all you people who loves each other, and I think I am that person who always feel happy to have Vidhu. I'm really proud of you. There's only one person nowadays I am really thinking, how come you came into my life? And not zone, you are FOGSI made me a very, very successful vice president. You established me. Thank you.
Thank you, ma'am. You're always at the back end, but supporting me always. Thank you so much.
Thank you. Thank you. Okay.
Thank you so much, ma'am.
I request each and every president and society of my team to remember and do support each other in case of need, in case of anything needed. And if we can do anything for our friends, it is really good for us. Thank you.
An exceptional guidance from everyone is required, and a balance is required. This teamwork is what is making this webinar a success. So I'm really thankful, ma'am. You have done exceptionally well. You have been working so tremendously every now and then and helping each of us, guiding everybody and everyone. So we thank you so much, ma'am. Thank you so much, Kalpana, ma'am. Your presentation was beyond expectations, ma'am. And thank you, Dr. Supriya, ma'am, and Vidhu, ma'am, for this particular second session. I now introduce Dr. Shaila, ma'am. I now hand you over for the third and fourth session. Dr. Shaila, ma'am, ma'am is a dear. Okay, ma'am, handing you over, ma'am.
So can we have the slides proceeding? So first introducing for our next session, that is medical management on PCOS. I have proud privilege of introducing and inviting Vineeta Singh ma'am. She is associate professor in the Department of GI in Patna Medical College and is consultant care hospital and IVF center. And we very well know her as president of Patna OBGY Society now. Ma'am has held various and innumerable prestigious posts, including FOGSI ICOG Governing Council member, YTP Committee Chairperson of FOGSI in 2017-2019, and she was Joint Secretary, Clinical Secretary, Treasurer, Vice President, Executive Committee member of Patna OBGY Society. So, ma'am, you are a true veteran, true academician, and especially contributing valuably to FOGSI, to West UP chapter of ISOPARB today, and YTP Promotion Committee of FOGSI. And with folded hands, we welcome you, ma'am. Next, we have, next CV slide, please. Our dearest Dr. Amber Khan, a young, dynamic, upcoming star of FOGSI. She is the secretary of Jaunpur OBGY Society and is consultant obstetrician and gynecologist, infertility specialist at GHK Hospital. She has worked tremendously in the field of cervical and breast cancer screening detection. She has organized several camps, and she has organized several educational CMEs, given guest lectures on anemia, breastfeeding, menstrual hygiene awareness in school girls and working females. And we very well know her as bubbling, always smiling, and always ready for any hard work. So, respected chairpersons, we welcome you, and I request Dr. Amber, can you do the honors, please?
Sure, ma'am. Good afternoon, everyone. My warm regards to everyone. It is my proud privilege to introduce respected Dr. Namrata Bhardwaj, ma'am. She is a consultant gynecologist at Bhardwaj Hospital and Advanced Laparoscopy Center, Aligarh. She was ex-assistant professor in Jain Medical College, Aligarh. Ma'am has won several awards for paper presentation. She has delivered the prestigious Kamini Rao Oration at AICOG, Calcutta. She has over 30 publications in reputed journals, and she has been a part of FOGSI Adolescent Committee. She is co-organizing secretary of 19th UPCOG at Aligarh in 2007. Her area of interest are high-risk pregnancy. She has been ex-treasurer Aligarh OBGY Society. Currently, ma'am is chairperson of Mission Pink Health IMA Aligarh, and she is secretary of Aligarh OBGY Society. We welcome you, ma'am, and kindly start your presentation.
A little love, a little understanding, and that's all they need. Periods are pathetic for them, and pain is what endures them through it. PCOS isn't just something related to periods. It's much more painful and drastic than that. It destroys a girl mentally, physically, and perhaps emotionally. So, next slide, please. We are talking about a polycystic ovarian syndrome, which was originally described as one in 1935 by Stephen. Next slide, please. Now we have 20 to 33% of all reproductive age group women today have PCOS, 87% women with oligomenorrhea, and almost 26% women with amenorrhea are diagnosed with PCOS. PCOS gives rise to almost 50% cases of infertility, and it has now been attributed to almost 50% cases of frequent miscarriages. Next slide. We have already talked about diagnostic criteria. We had a wonderful talk by Dr. Kalpana, but the Rotterdam consensus defined PCOS as the presence of two out of the following criteria. We know oligomenorrhea and or anovulation, hyperandrogenism in the absence of other etiologies, and polycystic ovarian on scan. Next slide. Just a brief look on the symptoms. Now, the symptoms can be as varied as fatigue, acne, mood changes, to infertility, excessive body hair growth, weight changes, and especially trouble losing weight, low sex drive, irregular and missed periods. Next slide, please. So we tend to divide these symptoms into three main headings. So those related to ovulatory dysfunction like amenorrhea, oligomenorrhea, irregular uterine bleeding, and infertility. Those related to androgen excess, hirsutism, seborrhea, acne, and polarization, and those related to insulin resistance like glucose level and obesity. Next slide, please. Now, just keep changing the slides. We have seen these girls with acne and hirsutism and alopecia and distressed soles. Now, we need to know that polycystic ovarian syndrome is a disease with a spectrum of clinical presentations. On the one hand, we may have a girl who may be PCO, but she may be ovulatory with no hirsutism, no dermatological changes. And on the other hand, we may have a whole disease spectrum of a woman having menstrual irregularities, infertility, obesity, hirsutism, all kinds of problems in the same girl. Next slide, please. A lab evaluation, as such, no particular biochemical test is diagnostic of PCOS, but we do a lot of other tests like serum testosterone. We have already been told this by Dr. Kalpana, LH, FSH, prolactin, 24-hour free cortisol, and tests for insulin resistance. Next slide, please. What should be our goals when we manage PCOS? Number one, identify patients with risk, who are at risk or who have already been diagnosed with PCOS. Number two, assess these patients appropriately for PCOS and associated disease states, and then prescribe therapy to treat complaints and to prevent sequelae. Next slide, please. Now,
Sorry for interruption. Dr. Namrata, can you speak a little loudly?
Okay. Is this okay? Is this okay?
Yes.
Okay, sorry. Any treatment for PCOS thus should optimally address not only the ovulatory dysfunction and hyperandrogenism, but also the metabolic features such as hyperinsulinemic insulin resistance, obesity, dyslipidemia, and abnormal protein metabolism. Hence, the treatment should not just be aimed for adolescents, it should be aimed for all age groups. Next slide, please. Keeping in mind, we tend to divide our management according to the various clinical ages of the patient, like adolescents, a newly married couple not wanting conception, a married woman wanting conception, and so on. And we will address them quickly one by one. Next slide, please. Let's talk of a girl who is an adolescent PCOS. Now, these are the girls whose main issues are menstrual irregularities, obesity, hirsutism, and acne. Next slide, please. So the management of these girls in the protocol would be, number one, counseling for weight reduction and life modification. We will not go in the details. We have a very excellent talk lined up by Dr. Seema for this purpose. Next slide, please. But one thing I would like to add is that a weight loss of only 5% of total body weight is associated with significantly decreased levels of insulin, improved menstrual function, reduced hirsutism, acne, and lower testosterone levels. So what are the, yes, please let's have the next slide. So these girls are mostly managed by OCPs. Hydroxyprogesterone, acetate, or methylized progesterones can be used to address the issues of abnormal bleeding. Now, if oligomenorrhea and amenorrhea does not respond to oral contraceptives and anti-androgen combinations, insulin sensitizing agents have to be added. And we have to understand that not just obese, but also lean PCOS girls may have insulin resistance. Next slide, please. A combination of ethinyl estradiol with drospirenone should be recommended for obese PCOS. Next slide. And a combination of ethinyl estradiol with cypertron acetate are ideal for hirsute PCOS. Next slide, please. We have just been taught about how insulin resistance is integral to the development of polycystic ovarian syndrome. So next slide, please. So we need to add insulin sensitizers. Now the insulin sensitizers, they directly sensitize insulin receptors, they prevent neuroglucogenesis and reduce absorption of glucose from intestines, and thus increasing the hepatic synthesis of SSBG levels and decreasing the free testosterone. May I have the next slide, please? So, Chiara's treatment criteria for metformin say, who are the girls who require metformin treatment? If she's having 8 or fewer menses per year, she's a hirsute and has elevated androgens, PCOS appearing ovaries, a fasting insulin of over 10 milli units per ml and over 50 milli units over 2 hours, and a hypoglycemic response to 2-hour OGTT. Next slide, please. Can I have the next slide? Okay. The other drugs which can be used, we had a wonderful talk by Dr. Neharika about nutraceuticals, so we will not talk about that, but spironolactone and finasteride are also being viewed for treatment of PCOS. Next slide, please. Next slide. Cosmetic treatment. Now we know that with the hair which have already grown cannot be reverted back, but anti-androgens may decrease prevent the further growth of hair. And next slide, please. Mechanical methods like laser waxing and shaving can be used for excessive hair. Next slide, please. Now our girl is a newly married girl and she does not want conception. So what are the treatment options for these girls? Of course, again, we come back to Dr. Seema's topic of a lifestyle modification, which we will be taught very soon. But oral contraceptive pills are the mainstay of treatment because they not only cause cycle regulation and effective contraception, they prevent weight gain and they control androgenic symptoms. Drospirenone or cypertron acetate containing pills are good, are to be recommended for these girls. The next slide, please. She has had enough of contraception and our girl wants to conceive now. So now we had a talk by Dr. Patna where we were told about clomiphene citrate and letrozole and options. And the treatment algorithm is, of course, preconceptual counseling on lifestyle modification followed by clomiphene citrate, letrozole therapy followed by Reproduction as the second line and the third line as IVF. Next slide, please. The only concern, let's skip these slides of clomiphene and letrozole. Yeah. The only problem with PCOS is that stimulation in PCOS is a problem. Response is not predictable, dose is not predictable, number of days of stimulation is not predictable, and OHSS is a real problem. Next slide, please. So next slide, please. We have been told about the stimulation protocols. So we, as Dr. Kalpana very rightly said, that diagnostic protocol is relatively safe for our patients with, who require IVF. Please, let's have the second slide, please. So Dr. Karna has succeeded in treating this girl with infertility, and our lady is not pregnant. So what are the issues that we need to address in a lady who has had PCOD and is not pregnant? We need to know that almost 50% cases have frequent miscarriages. These ladies are potential candidates for developing gestational diabetes, pregnancy-induced hypertension, and intra-uterine growth limitations. Next slide, please. Should we continue metformin? Now, see, most studies, they say that in a woman of PCOS, continuous use of metformin during pregnancy does significantly reduce the rate of miscarriage, gestational diabetes, and PPD. And our monitoring of these pregnancies have to be like any other high-risk pregnancies, like GDM screening in the first visit, OGTT screenings, early scans, NT-MB scans. We try and artery node scans for prediction of early IUGRs and color Dopplers. So basically, these should be treated as high-risk pregnancies. Next slide, please. The lady has successfully delivered a child, and now she wants spacing. So what are the choices that she has? Oral contraceptive, because they are the mainstay of treatment of PCOS, again, they are the best options for this women also. But if they wish to use some other form like IUCDs, we have to ensure a 2-monthly withdrawal to avoid the long-term complications of unopposed estrogen action on the endometrium. Because remember, these are the women, if their PCOS returns, they will not menstruate unless you give them. Okay, so now our lady is growing up and she wants another child, but due to either recurrent miscarriages or because of other factors, she is not conceiving and has landed into secondary infertility. Next slide, please. So again, Dr. Seema's role comes into play, diet, exercise, weight reduction, because these are the ladies who tend to let go once they have one child. So they need to understand that lifestyle modification still forms the mainstay of treatment. And if she's anovulatory, we start her on ovulation induction. If there is a pregnancy loss, she has to be managed accordingly. Next slide, please. The lady has conceived, she's delivered a second child. Now, I want to have a word about mature PCOS. These are, normally when we talk about PCOS, we think of girls, young girls, fat girls, and suit girls, but this PCOS is a disease for life. And we are now having cases of mature PCOS who present with irregular periods, with prolonged periods of amenorrhea, obesity, not able to lose weight, lethargy, the acne come back again, and maybe a slight excess in weight. And next slide, please. So, can we have the next slide, please? So, what are the therapeutic goals for mature PCOS? Now, in women who have completed their families, the management has to be in terms of managing menstrual irregularities, preventing cardiovascular disease, diabetes, and we know that endometrial malignancy has a high rate in these cases. Next slide, please. So, if they are left untreated, these mature PCOS ladies will end up as patients of metabolic syndrome. And metabolic syndrome is a complex of diseases ranging from type 2 diabetes, atherosclerosis, hypertension, predisposing to coronary artery diseases, a 5 times increased incidence of pulmonary cancer, and if I may add, sleep apnea. Now, sleep apnea is a condition which is very addressed in our clinical situations. This is one condition which we should always look for in these cases. Because they are obese and because they have other metabolic changes. Next slide, please. So again, management in these ladies would be lifestyle modifications, diet, insulin sensitizers, OCPs, statins, antidiabetics, and antihypertensives whenever required. And now we come to our nutraceuticals, which we were talking about, omega-3 and micronutrients, inositol, and these are the times which come. These are the ladies who really require. She has reached a perimenopausal age group. Now, again, I would like to emphasize she has a 7 times higher risk of diabetes, a 4 times higher risk of hypertension. Irregular cycles may or may not be because of PCOS, but she does have an ability to access protein. So these are the various issues like cardiovascular diseases, endometrial cancer, and metabolic syndromes, which need to be addressed in a woman who is of a perimenopausal age group. Next slide, please. With or without our idiosyncratic issues, our lady has become menopausal, but she has developed a long-term complication of metabolic syndrome. So the last two slides I would like to say about metabolic syndrome. What are the WHO criteria for these? We can have central obesity and high insulin resistance, high blood pressure, high triglyceride levels, and a type 2 diabetes mellitus. Now, this is a disease complex, and our girls with PCOS have a higher tendency to land up into metabolic syndrome in the post-menopause age group. Next slide, please. And again, the treatment of metabolic syndrome would be addressing the issues that she's dealing with in the form of either statins or antihypertensives, antidiabetics, and I cannot emphasize enough about lifestyle modifications even at this age group. Next slide. So, what are the take-home messages? When evaluating women with PCOS, including young adolescents, not only should we be addressing the problems with the adolescents face, but physicians should assess the patients for all components of metabolic syndrome. And therefore, evaluation in terms of blood pressure, waist circumference, BMI, fasting lipids profiles, and glucose tolerance should be undertaken even unhealthy. The next take-home message would be, can I have the next slide, please? That the combination therapies are most effective. Diet control, lifestyle modifications alone may not be adequate, and pharmacotherapy is generally required at various stages of life as the woman grows up. And insulin sensitizers before development of diabetes are controversial, but they are now increasingly being used for insulin resistance. Now, PCOS has been defined as thief of womanhood, and it needs to be treated at all ages, not just in adolescence or not just in infertility. My lifestyle slide would say that don't let PCOS define you. You are beautiful inside and out. Stay strong because you're worth it. Thank you very much for a very patient.
Thank you so much, Namrata ma'am. And since I think Dr. Amber had to leave for an emergency, if Archana Verma ma'am is here, then we would like to have her expert comments on ma'am's talk, which was very nice. So ma'am has already highlighted taking messages, lifestyle modification, and such beautifully you have narrated the story kind of version. Everybody would have very well related to your style of presentation. So ma'am, next, before we thank you for your presentation, we would like to thank you for your strong association with West UP chapter of ISOPARB and all the activities that we carry forward. You're so diligently involved in that. And I'm sure it was a treat for audience to listen to you today. Thank you so much, ma'am.
Thank you very much. Thank you, West UP ISOPARB for having me. Thank you.
So we have the permission from seniors to move ahead to our next scientific session. Dr. Dept, I would like to request you to kindly display please. Dr. Renu Bansal, ma'am is the first chairperson for our last but not the least session. She has done her graduation and post-graduation from JNMC Aligarh. She is an active member of Khabur Menopause Society, and she has been practicing there for 26 years, and she runs her own nursing home by the name of Ashirwad Nursing Home. And at present, she is treasurer of Khabur OG Society. So we welcome you, ma'am, over here. Next, our chairperson is none other than Dr. Shazia Munis. She is another dynamic consultant practicing in Moradabad. Everybody knows her name. She is right now president of Moradabad OBGYN Society, and she is a proud alumna of KGMU Lucknow. She has worked as coordinator of various FOGSI projects, including anemia and menstrual hygiene projects, and owner of Hope Hospital Moradabad. She is, and she has huge fan following amongst patients as well as doctors equally. Next, we have Dr. Priyanka Guard. आज शायद ये प्लेटफॉर्म नहीं कि मैम की ब्यूटी का बखान किया जाए. Otherwise, we all are great fan of Dr. Priyanka Guard. She is secretary Meerut OBGYN Society, and she has done her MBBS from SMS Jaipur, and she has received various awards, and that includes Savai Man Singh Gold Medal for standing first in MBBS in entire Rajasthan state. And yes, now we know that we are welcoming a great academician on this platform. She has more than 10 years of experience as UG and PG teacher in Government Medical College. She has co-guided around 50 teachers' thesis, and wow, that's the number. So her field of interest also involves minimal access gynae surgery.
So we welcome all the three chairpersons on this prestigious platform again. And I request them to kindly introduce our speaker, who is brilliant, beautiful, Dr. Seema Vaheshri, the backbone of entire program of today. So over to chairpersons for her kind introduction.
Hello, ma'am. May I speak the introduction, ma'am?
Yes, ma'am, please.
Hello, good afternoon, everyone. Now, I am very much humbled and privileged to be the chairperson of this society. Now, I welcome my Dr. Seema Vaheshri, ma'am. She is a very dynamic and laborious secretary of the West UP chapter ISOPARB, and she is chairperson GOGS 2021-22. She was past president GOGS 2019, and she has received Wonder Women FOGSI Award 2019. She is at present joint secretary UPCOG 2020. And she has received Best Sports Women IMA Ghaziabad 2021, and she has received second Best Lady Doctor UP IMA 2021. She is a yoga coordinator in IMA Ghaziabad, and she has a special field of interest in high-risk pregnancy and infertility. Welcome, Dr. Seema, ma'am.
Thank you, Dr. Renu, for your wonderful words. So we have listened and discussed polycystic ovarian syndrome since far. Polycystic ovarian syndrome is what should I say? इसको समझना मुश्किल ही नहीं, नामुमकिन है. हम लोग इतना ज्यादा पढ़ते हैं इसको और बहुत समझने की कोशिश करते हैं. तो कुछ और पढ़ते हैं इसके बारे में. We quickly revise PCOS as we know each and everything. It is just a revision. So it is a very common hormonal disorder among young girls and women of reproductive age. 1 out of 5 women have PCOS, but many are still unaware. As the name suggests, polycystic ovarian disease, syndrome is having enlarged ovary, having a small cyst. Everybody knows Rotterdam's criteria, that is 2 out of the following 3 criteria. Oligo and or ovulation, clinical or biochemical features of hyperandrogeneous polycystic ovaries on ultrasound. So nobody knows its etiology. It could be genetic, it may run in families, and if a woman has PCOS, then daughter is at increased risk of developing PCOS. So a hormonal imbalance is there, which causes symptoms of PCOS, which in turn causes an increase in high testosterone, and which in turn causes high insulin, and which in turn causes hormonal imbalance. So these 3 are interlinked with each other and causes symptoms of polycystic ovarian syndrome. Then insulin is a hormone that regulates blood sugar and turns food into energy. And in PCOS, insulin resistance is there, which causes weight gain, because hyperinsulinemia caused by insulin resistance causes decrease in lipolysis and it increases fat deposition in adipose tissue, and also it increases the level of inflammatory markers like IGF-1, insulin-like factor, which causes increase in cortisol level, and which causes which increases the weight. So it is responsible for the weight gain. So insulin resistance also causes increased testosterone level. This cycle is vice versa. One causes another. So what are the signs and symptoms? Because of hormonal imbalance, there is irregular periods. Because of hyperinsulinemia, there is weight gain, and because of hyperandrogenesis, high testosterone level, there is acne and hirsutis. And normally a woman ovulates every month, but in PCOS, follicle are so there are so many follicles and there is an ovulation, so resulting in infertility. So there is excess hair on chin, face, arm, and legs, and there is oily skin, so there is acne and dandruff. Because of hyperandrogenesis, there is thinning of hair and hair fall. And there is acanthosis nigricans. It is a pigmented fold on the nape of the neck under arms, under axilla and inner side of the thigh. So weight gain, being overweight, there is because hyperinsulinemia and all the hormone imbalance causes weight gain. So because of weight gain, there is difficult to manage PCOS, and because of PCOS, there is increase in weight. So it is also vice versa. So look at this lady. This is she is obese, and obesity is a high risk factor for PCOS. So when she looks in the mirror, she feels negative body image, and this leads to depression, and this leads to eating disorders, and this leads to PCOS. So and weight gain and menstrual symptoms, they are all ill effects of the PCOS. So obesity itself is a high risk factor for PCOS, and PCOS causes obesity. So there are long-term sequelae: obesity, diabetes, heart disease, and cancers. So now, how to treat PCOD naturally? Because pharmacological treatment has been taken very wonderfully by Dr. Namrata Ahuja and Dr. Kalpana, infertility treatment in PCOD. They have taken a very good presentation, and Dr. Neharika Malhotra has taken a very good presentation, has given very good presentation on nutraceuticals. So I am taking all that, but it is a all revision. So I am taking lifestyle management, how to treat PCOD naturally. So we can manage PCOS by diet and exercise. Both will give weight reduction. And because PCOS is increasing because of there is change in lifestyle and increase in stress at each level, especially in adolescent groups, and which leads to infertility in their later life. So control PCOS with lifestyle modification. First of all, exercise or physical activity, 30 minutes of brisk walk daily, or 40 minutes workout 5 days a week, like yoga, like cycling, like outdoor games, like dancing, anything she can choose when the condition permits. So what is a healthy diet for women with PCOS? The PCOS diet: no dairy, no gluten, focus on low GI food, low glycemic index food, no processed or refined food, protein or healthy fats with every meal or snacks, eat whole foods, fresh vegetable, lean meat, and some fruits. So PCOS is one of the most common endocrine disorder in women of reproductive age. There is no cure for PCOS. Certain dietary and lifestyle changes can help you, and it helps prevent symptoms and potential complications. So what are the low glycemic index diet? Because it is helpful in treatment of PCOS, because body digests food with low GI more slowly than food with high GI, and because insulin level do not rise as quickly. Foods with low GI are whole grains, legumes, nuts, seeds, fruits, starchy vegetables, other unprocessed low carbohydrate foods. And because in PCOS, there are increase in inflammatory markers, so we have to switch over anti-inflammatory diet like berries, fatty fish, leafy greens, olive oil. They may reduce inflammation-related symptoms such as fatigue, stress, and other things. So nowadays, there is DASH diet, that is dietary approaches to stop hypertension diet to reduce the risk of impact of the heart disease. It may also help to manage PCOS symptoms. And DASH diet is rich in fish, poultry, fruits, vegetables, whole grain, and low-fat dairy products. DASH diet discourages foods that are high in saturated fat and sugar. Now, what to eat? The basic diet for PCOS diet are to focus on whole grains, fresh products, and plant-based proteins while limiting sugar, processed food, and trans fat. There are high fiber fruits and vegetables, leafy greens, vegetables, root veggies, red berries and grapes, beans, legumes and lentils, whole grain or multigrain bread, crackers, pasta, tortillas. Tortillas are the thin rotis or chilas made by whole wheat with baking powder and sugar. They are made on the non-stick tawa, so we can avoid all the oil, and they are very tasty. Then brown rice and quinoa, and oats, rye, barley, and flax, chia, sunflower seeds, cottage seeds, lean chicken or turkey. Then we can take veggie burgers. We can avoid that maida bun. We can replace them from bread, whole wheat bread, and in between we can take all the green vegetables and fruits, and we can roast those bread. So we can make tasty veggie burgers. We can advise our patients. So egg whites, egg substitutes, low fat and Greek yogurt. Greek yogurt is made from normal curd. The extra water and whey is sieved, and it is to be tied in a cloth for hours. Then we can make this Greek yogurt. This is very helpful in treatment of PCOS. Then non-dairy milk alternatives, almond and rice. Then avocado, hummus, coconut and coconut oil, nut and nut butters, olive oil, flaxseed oil, fresh herbs and spices, and dark chocolate and green tea. The study shows that consumption of green tea by overweight women and obese women suffering from PCOS leads to weight loss, a decrease in fasting insulin, and decrease in the level of free testosterone. So it is very helpful. Then fenugreek studies shows that fenugreek seed extract, 2 capsules of 500 milligram each per day, that contains insulin sensitizing compounds, which improves insulin sensitivity. Significant decrease in LH and FS ratio was observed. Significant reduction in ovarian volume and follicular cyst size. Significant improvement in menstrual cycles and improved pregnancy rate. There are some studies which shows that pomegranate juice, symbiotic pomegranate juice, it can also improve insulin resistant, testosterone level, BMI, and it is very useful in PCOS. And then cinnamon. Cinnamon significantly decrease serum fasting blood glucose, insulin resistance, and total cholesterol, LDL, and increases HDL. It also improves menstrual regularities. So we can conclude that cinnamon, 1.5 gram of cinnamon supplementation for 12 weeks improved antioxidant status and lipid profile and menstrual irregularity in women with PCOS. Then flaxseed study also showed about the flaxseed, a food generally renowned for its omega-3 fatty acid content. We have listened in nutraceutical presentation by Dr. Neharika. She was telling in omega-3 and other antioxidants which are necessary for treatment of infertility and menstrual irregularities. So flaxseed is rich in omega-3 fatty acid content, also is one of the richest source of dietary lignin, and suggested to decrease androgen level with concomitant reduction in hirsutism. And it is suggested to normalize lipid levels. And one word about quinoa. It is very good. It is having high protein value, improved digestion, and it helps to maintain weight loss and acts as a gluten-free alternative. It also helps treat and prevent cancers. So it can also be taken in the various formations like roasted quinoa, or we can make a very tasty khichdi also. Then in general, people on PCOS diet should avoid food already widely seen as unhealthful. So what should be avoided? Refined carbohydrate such as mass, produce pastries and white bread. And because we know all the dairy products are rich in inflammatory markers, IGF-1. So we should avoid this dairy products and fast food. They can increase your cortisol in body, and they can again in turns into the weight gain. And we should avoid sugary beverages such as sodas and energy drinks, processed meats and solid fats, and excess red meat such as steaks, hamburgers, and pork. So in conclusion, Combined nutritional supplement, including herbal medicine and lifestyle interventions, can lead effective and most likely safe in management of women with PCOS. Now, a word about sleep. We often counsel our patient with diet and exercise and weight management. We should also counsel them about the sleep because they should take proper sleep. Sleep deprivation also causes hyperinsulinemia and causes weight gain. So sleep, not just how much you eat or how much you exercise, can help you achieve your optimal weight. College student between the ages of 18 and 22 need at least 8 hours of sleep every night. Most college students report only getting about 6 hours or less sleep per night. And sleep affects hormone levels, changes body composition, can increase the number of food intake episodes, can increase potential intake of high energy dense food. There are two hormones in our body, ghrelin and leptin. Ghrelin level tells us what to eat, when to eat, and leptin level tells when to stop. When our sleep deprived, then these ghrelin level increases the GO hormone that tells you when to eat, and leptin level decreases the hormone that tells you when to stop eating. So the number of food intake episodes can increase when you are awake for more hours during the day, and overeating and more frequent food intake episodes occur mostly in the evening. So sleep deprivation is important factor. When you are sleep deprived, you can gain weight instead of losing weight, having diet and exercise and all that. In spite of all these things, you can gain weight. There can be an increased consumption of fast food, dietary fat, caffeine, and sugar and carbonated beverages, and there is a decrease in consumption of vegetables. So if we lose weight by 5%, menses restore, and if we lose weight by 10%, fertility restores. And we should also counsel our patient, don't self-diagnose, don't self-medicate. As they do, they come with Google information, and everyone having PCOS or we don't know whether they have PCOS or not, because they take the Google's information and they come with crying faces. We are having this PCOS. We are having PCOS. We should actually diagnose them properly about their disease, and we should counsel them about the lifestyle management, diet, exercise, and also the sleep. Thank you.
Thank you so much, ma'am. Seema ma'am, you have like well summed up the whole topic from A to Z, from the session first to last. I think this is what we really needed for the conclusion version. And I now request Dr. Renu ma'am to please give their expert opinion, and if Dr. Priyanka ma'am is available.
Thank you, Seema ma'am, for a wonderful and a crisp talk. I think you have covered everything. The main gist is we should advise the patient to reduce the sugar and the carbohydrate intake, and they have to manage weight, exercises, proper sleep, doctor consultation, and above all, behavioral modification should be there. Thank you, ma'am, for the nice talk. Hello.
So we have reached at the end of the session.
Thank you so much, ma'am, Dr. Renu ma'am, and Dr. Priyanka ma'am, if you're available. If not, we'll quickly conclude, and please stay back for the vote of thanks. Thank you so much,
Monisha,
yes,
you can give official vote of thanks. Otherwise, thank you, Dr. Kalpana, for giving associating your society with West UP ISOPARB, and for giving wonderful lecture on infertility in PCOS. And Dr. Neharika has given a very vibrant and very good presentation, very informative. We have been using all the these antioxidant, but we know today we are known. The name is Nutraceuticals. So we came to know this new term. And Namrata, you have taken a very good presentation, a very good on pharmacological treatment of PCOS. And Thank you, everyone. And Monisha, will you please give official vote of thanks to everyone?
Thank you so much, Seema ma'am.
Especially a very good thanks for Dr. Deepika. You are
absolutely.
proceeding with that, no?
Yes, thank you so much, ma'am. From behalf of West UP ISOPARB YTP Committee and Madurai OG Society, first of all, I extend my most sincere thanks to the Almighty God for making today's event a resounding success. Apart from this, with your blessings and grace, we would not have been able to make this event for what it was. Thank you to all the dignitaries. On behalf of the same, I extend a really hearty vote of thanks to our chief guest, Dr. NM sir, our guest of honor, Dr. Ranjana ma'am and Dr. Bharti ma'am, who spared their precious time from their busiest schedule to grace this occasion. Today, we had an opportunity to hear your thoughts, and this will surely be going to encourage in our future events. Thank you so much. I also extend thanks to our revered chairpersons for their enormous cooperation and for putting up their amazing thoughts and inputs. And this will always be helpful for us and our future patients. You have been the catalyst that stimulated us to do our best and standing as a pillar of strength. I'm immensely thankful to our office bearers, especially Dr. Archana ma'am, Dr. Neharika ma'am, Dr. Kalpana ma'am, for her absolute efforts towards this webinar. Your own ideas and elegance of explanation for the PCOS, I need not mention my deepest sense of appreciation. An event like this doesn't happen overnight. The wheels started rolling weeks ago. So for this, we have been fortunate enough to be backed up by a team of very proactive and dedicated team from the Jagsonpal, who were very well versed in their job. Last but not the least, a big thank you to each and every one of you who could attend and stay back till the last session for this wonderful webinar and making this event a huge success. We value your and each and every moment that you stayed for this particular webinar. So I now hand over this session to Dr. Deepika to conclude.
Before that, Dr. We would like to thank Dr. Shaila Jamal and Dr. Manisha, our dynamic MOCs today. You have made so much, the webinar very successful.
Nothing
Deepika,
could be possible without you, ma'am. Thank you so much.
Thank you so much.
Thank you so much to all the three societies who have taken us as their partner for this webinar on such an important topic, and especially so because we do have a few products which do relate to PCOS. So I have with me our marketing manager from NAARI division of Jagsonpal, Mr. Saurabh Sharma, and he'll be just taking a few minutes to run you through a few of our products for PCOS. Mr. Saurabh, please.
Thank you very much, Dr. Deepika. Thank you very much, all dignitaries. We are very happy to just hosting this such kind of informative sessions. Like Cystelia-M, which is a right combination of minoxidil and decaracetal and albuterol, right combination to restore the reproductive health. It is very common drug which you are writing. So please do prescribe in PCOS and associated infertility, the Cystelia-M. We do have another product which we can say Cystelia-35, which is used in acne associated with the PCOS. And we have Cystelia-35, cyclopentone acetate, and Cystelia-35, which is widely and readily prescribed drug. It is dependable choice for predictable results. This is a very cost economic, and we are the least cost. And we do have another product which can say ProRetro. We have developed the ProRetro, which is available internationally also. And we have a longer shelf life of 36 months. And ProRetro is a unique name. We derived retro resistance, and which is 29% economic also.
Thank you, Mr. Saurabh. Now for all, we do request your presence again for another webinar. Take this opportunity to thank all of you for joining us, and do join us